happy on behalf of the Health Committee to welcome you to this exciting meeting. This is an area which is quite new for me, and I'm really looking forward to this fantastic program that you put together. I'll start by asking you to put your mobiles in silent mode if you've not done that. Climate change is severely affecting our health. We must focus attention on this. When the COVID-19 pandemic came, we were not prepared. We cannot afford to be unprepared for the health consequences of climate change. A record hot summer in Europe 2022 caused 62,000 deaths. As in the pandemic, those that were old and frail and those living under poor socioeconomic conditions suffered most. Science must help society to prepare for the health consequences of climate change. Science must also highlight the health benefits of strategies for fighting climate change, including improved air quality, better food habits, and a more physically active lifestyle. With that, I would like to welcome Maria Nilsson down to inform you a little bit about the program for today.
Thank you, Jan, and thank you everyone for being here today, and heartfelt welcome from us. And I think I speak for the both of us, myself. My name is Ilona Riipinen and Professor Maria Nilsson here. If I say that we're very honored to represent this program group from the Health Committee of KVA, who has sort of put together the program today. And we hope that it will be an educational and thought-provoking and inspiring day. And maybe I should also start by saying that it's just the beginning, so there will be more to follow. And we will come back to that, but one of the sort of key aims of today is to bring together researchers from different communities in Sweden. And I think already so far I've spoken to many, and many have said, I feel a bit uncomfortable. I'm not really an expert. And I feel exactly the same way. And maybe I should say that my own background is more in the climate community, working especially with the aerosols and clouds in the atmosphere. Maria, maybe you want to introduce yourself.
Absolutely, and I have a completely different, well, of course I'm interested in the atmosphere, but absolutely not an expert. I'm a professor of public health, and my professorship has the orientation climate change and health. We are working at Umeå University on the department where I work, but also we have in the session on temperatures, researchers from Umeå University as well, from another unit there. I'm also editor-in-chief for a science journal called Global Health Action. And in that journal we also, of course, have an interest, as you can hear by the name, on making research used. And we also have a view of the importance to build capacity, both in the north, of course, but more so in the south, the global south. And we have collaborations and mentorships at the journal to help researchers to come into good projects, but also to get to learn, to get mentorship in science writing. Happy to be here today as well as you, Ilona. So, should we start?
Yes, let's go forward. So, we thought of starting with a little dialogue. So, as a climate researcher and as a representative of the Bolin Centre for Climate Research, where we have all the different compartments of the Earth system, when I look at this picture, I often like to show it actually. But when I look at this picture, what I see there is the sun, the source of energy. I see our Earth. I see oceans. I see land, I see clouds, of course, because that's part of my own research. I see that the clouds are white and they reflect solar radiation, so I see that, you know, there's probably some consequences for the energy balance. I also see lights. You can see some lights there where you see Europe. And of course, that's the sign of us humans. And you know, that leads me to think, how does changes in the Earth's energy balance, the climate, how does that influence us humans? How do we influence climate? And of course, also you see the green forests there, coupling in the ecosystem, which we are critically dependent on. So Maria, what do you see?
I of course see the beauty. It's easy to become a bit moved, I think, to watch the planet from a distance in this way. But I don't think about the clouds that much. So I focus more on the lights I see there, thinking about the people living here and how we also see changes, how people move, how people will have to move due to what we see happening now with climate change. And also about urbanization that is ongoing. What can that mean in terms of climate change and health impacts? I also think about where we see that poor people live. What will happen to them in the townships, where people live who are really, really poor in urban areas. So I also think about bad things or difficult things, of course, when I watch this picture. So I'm more into the cities, I think, when I watch this.
So hopefully from this completely unpracticed reflections from two researchers representing different communities, you get a flavor of the types of reflections, the types of different perspectives we who are in this room and also outside of this room, of course, can have when we look at this problem of climate and health and their interactions. And this is kind of part of the logic of why we thought that it's important to have this symposium. We think it's important that we look at this topic of climate and health from different perspectives and we exchange, and perhaps also we can all learn something from each other. And I'm sure that I will learn a lot looking at the amazing lineup that we have for today. So we hope that we can discuss and exchange knowledge. This is kind of a research-focused symposium. So to kind of all come to the same page, if we put it that way, we want this symposium also to serve the purpose to summarize the state of the science related to both sort of climate change and health and their interfaces. And eventually also then to bridge to relevant policies, what we can all do, and solutions. And Jan already nicely alluded to this. But I should already now make a little advertisement that we will have a follow-up of this symposium that's more oriented towards policies and solutions, if we put it that way, in spring 2024. And here's the outline of the program today. It will be an intense day. And with this, we would also like to encourage all the moderators to maybe, if there are a couple of minutes to spare, to encourage people to stand up in between the sessions, because we only have 2 breaks, basically. We have the lunch break and the coffee break in the afternoon. And we discussed this a lot in our little working group. How should we lay out the day? Because you can approach this problem from so many different perspectives, and there's also so huge need also to discuss solutions. However, we now chose in this first symposium a very kind of elementary approach, and we thought that is a little bit beautiful as well. Temperature, which is a fundamental parameter describing how the conditions here and the energy balance, if we think about the basic thermodynamics. Then we have a session on air. air is kind of vital. We won't survive very long without air, and clean air is important for us to feel well. Then we have a session on another kind of an important element for the life on Earth, and that's water. And finally, yet another thing that it's hard for us to survive without, and that's food. And all of these topics are relevant for problems associated with climate and health. And then the final session is then about moving forward. What are the policies, what are the measures that we can do, what are the co-benefits that we might have in mitigating and adapting to climate change from the health perspective.
I would just like to say also, when looking at this slide, we can really see why we need to work across disciplines. And this is certainly an area where we can't come forward without a good transdisciplinary work.
Indeed. So then we have decided to divide this time so that I show a few just background slides. There will be a lot more in-depth discussion on this from the kind of climate side, based on the latest Working Group 1 report from the IPCC, which summarizes the physical science basis, kind of according to the sessions that we have. I already said this, that global and regional temperature change is kind of the primary measure and has traditionally been the primary measure of anthropogenic climate change. And this we already know that it is unanimously kind of proven that there has been, first of all, warming in the recent decades since the industrial time of about 1 degree. And it's human activities that have caused this warming. And this picture just shows the regional distribution per 1 degree global warming. And what you can see here is that different regions stand out differently, so that especially the poles are warming faster than the rest of the globe. And of course, this also presents a challenge to the vulnerable ecosystems and the communities living here. Another thing that one can see here is that when it comes to our understanding of the drivers of the climate change, present climate models are doing rather well when it comes to, for instance, representing the regional distribution of the temperature changes. Then extreme events have been quite a lot in the discussion recently, so I thought that I would include another slide about the assessment of observed extreme heat and how confidently we can, or the climate science community, that can link it to anthropogenic climate change. And this is also from the IPCC. What you can see there is kind of the world map. And then wherever there is a red color, it's an increase in the observed hot extremes. And then besides the color, what you see also there are these dots. And this links to the confidence in human contribution to the change that has been observed. So that if there are many dots, the more certain the climate change research community is that this is because of their anthropogenic impacts. And one can see that it is with a rather great confidence. One first of all sees increase in the extreme heat, and also that we're confident that it's because of the human activities. Then our second session was about air, and especially air quality and climate and their links. And here I sneaked in a little bit of very recent research. So air quality and climate are interlinked. I don't know how many of you know this, I guess most of you know this, but besides the anthropogenic greenhouse gas emissions, during the industrial time, humans have also influenced the amount of aerosol particles that there are in the atmosphere. And these aerosol emissions have kind of masked or offset part of the warming caused by the greenhouse gases. And to be able to make as accurate as possible projections of how future climate will change, we also need to know how big this impact will be, has been, and how big will it be in the future. And of course, this then links to air quality measures and measures that we take to, on one hand, improve air quality, but also, of course, air quality is linked through emissions from similar sources for both air pollutants and greenhouse gases. And I mentioned that this is from a recent, that there are some photos from a recent measurement campaign that we have taken in the Italian Po Valley, so from Europe, which is one of the most polluted regions in Europe and has been kind of subject for decades of air quality research. And besides being polluted, it is also experiencing regular fogs. So there's also interactions between clouds, which I've already talked about, that are an important component of the Earth's radiative balance. This is a satellite image there. And the fact that you see white clouds already tells you that they are reflecting solar radiation. But these clouds are influenced by the amount of aerosol particles, that are there. So that, simply speaking, the more particles we have, the wider the clouds are, and therefore also their optical properties are different. If we then take samples, speaking of air quality, if we take samples of this cloud water, this is what it looks like. So believe it or not, this is not some cola drink, but it is actually the cloud water. So you really see the implications and the direct interactions between air pollution and the clouds. And then this is just our little measurement container there, and you can kind of see this visible haze. So besides influencing clouds, these particulate air pollutants also directly scatter and absorb solar radiation and affect the energy balance of the Earth that way. But you will hear more about this in the coming presentations, I'm sure. Then moving on to water. So besides the temperature changes that we hear and have heard about, climate change, of course, also affects the hydrological cycle profoundly. And I will not have time to go into great detail about this, but here are similar plots as I showed about the regional distribution of the temperature changes for changes in the annual mean precipitation relative to the pre-industrial time, now grouped per 1.5 degree global warming, 2 degree global warming, or 4 degree global warming. So first of all, what you can see here, if you look at the color scale, is that there are both values that are in this end and in this end. So some regions in the world will get drier in terms of precipitation, and some will get wetter. And this is still an area where, if we think of the fundamental climate science, where we still have some work to do to also improve these projections, because water is kind of necessary for life on Earth. Then also related to the hydrological cycle, a similar plot on the soil moisture. Again, maybe the message to take home from here is that some regions will get wetter, some regions will get drier, and we need to know which ones and why, and how that influences, for instance, our food production. Here are then similar plots that I showed for the temperature, but now for the heavy precipitation, where we see again that there has been an increase in extreme precipitation, and that there is some confidence that this is associated with the anthropogenic climate change, albeit to a lesser degree than with the heat extremes. And here's the same plot, but now for droughts. And again, what you can see here is that primarily the colors that we see are either showing an increase or lack of data. And kind of this is also kind of consolidating the message from the previous slide that this is highly regional effect when it comes to the hydrological cycle. To summarize, however, temperature, precipitation and soil moisture, they all are central for food production, which links to our food session. And on the other hand, this then feeds back to greenhouse gas emissions and climate. This is actually a very outdated figure I learned, so there has been a new one released, but this is what I often show. So this is kind of my link to the health community often, where there have been different kinds of risks ranked. I'm not going to talk a lot about this because I will soon hand over to Maria. But if we look at this ranking of risks, in the x-axis here is this disease-affected life years, and then here are different risks. And different colors here are different health outcomes. I will not go into the detail. You will hear about this more, I think. And what we have here is kind of makes sense in terms of the sessions that we've chosen. We have dietary risks, child and maternal malnutrition. This is now just for women. Blood pressure, air pollution is here, number 4, and so on. We also have here unsafe water, sanitation, and hand washing, I see, yes. So linked to our water session. So air, food, water, all are here quite high on the risk, so they really affect our health. I'm starting to feel really uncomfortable here, so I think I leave over to Maria.
Thank you. Thank you so much. One could believe that we should know a lot about climate change and health impacts, and we do today. But it's a relatively young research area. During recent decades, though, the knowledge has increased. And in 2009, the Lancet published the first Commission report about climate change and health impacts. And in that report, they stated that climate change is this century's biggest global health risk. And they said also that with current emissions that they saw then, we could also expect that the UN temperature goals and the health gains we've had during the last 50 years would be lost, that they were threatened at least. The health effects of climate change arise primarily from rising seawater levels, from rising temperatures, and increased extreme weather events. And those challenges, they also interact with socio-demographic factors, socio-economic factors, demographic factors, and environmental factors. And also they affect both the magnitude and the patterns of risk. On this slide, you can see illustrated that we have the direct effects that comes from extreme weather such as storms, droughts, floods, and heat waves. And then we also have the indirect, as you can see here. And that could be, for example, about water quality, but also access to clean water. It could be also exposure, of course, to air pollution, as been mentioned also before, one of the really important and large areas relevant for what happens with climate change. We also have deterioration of food supplies, food safety, that is important in this area. And then we also have establishment of new vectors and also changed transmissions of already existing infectious diseases, which also is important in this research area. At the right-hand side, in the grey boxes, you see examples of health effects that we currently have quite a lot of research in, where we can say things, being quite secure, actually, also, about what we say. We have mental health illness. There we need more research. We need also research so we can also talk about cause and effect in a different way than we can today. But there is research enough to say that mental illness is a field that is important in relation to climate change and health. We also have the malnutrition, we have allergies, and also, of course, other types of respiratory diseases and also lung diseases. We have cardiovascular disease. We have also injuries from extreme weather events. Also poisoning. And some people say, why poisoning? Well, when we have, for example, floodings, things may come up to the surface in the water. I mean, if you have, for example, a factory where you have used chemicals, then that can come up to, come to the water, and through that also be, of course, a huge problem because it's difficult to control. What we can conclude is that we need to really strengthen this research more. I usually say that through this research we sort of put a human face on the climate changes that we see. That may make us easier understand the world that we live in and also the future where we will live and how climate change will impact our health and well-being. Hopefully that can serve as a motivation for, of course, all of us, but also for policymakers to step forward and do what they can to protect human health and well-being. We have just published, just a few days ago, the last Lancet Countdown on Climate Change and Health. We started with a Lancet Commission report in 2015, and there we recommended to do a publication every third year, a Lancet Countdown. But the Lancet came back and said, we want it annually, as a warning bell before the UN climate meetings. So we have had plus 40 indicators that we have followed since 2016 annually. And that is a challenge. I mean, those of you who work in research understand the challenge of being able to present new data annually, for example, on adaptation. That is a challenge. But since we started in 2016, we have produced those reports with annual updates, and we work constantly on improving indicators. In 2023, we have had so much in the media. We have followed extreme weather events. We have followed how temperatures have increased. We have had reports on that, for example, from Copernicus. And the world has, when we come to an end of this year, we can say that this will have been the hottest world, hottest temperatures seen in the world during probably around 100,000 last years. And as you can see on this slide, one of the indicators that we look at is, of course, consequences of health by those increasing temperatures. We have several indicators on that. But as you see here, 60% of the 86 days of health-threatening high temperatures were made at least twice as likely to occur than as if it hadn't changed, the temperatures hadn't changed. We can also see that heat-related deaths of adults over 65 have risen by 85% since the 90s. In the report you can also see, of course, all the baseline. If you look into that, you can also follow details on how this is reported. And then food insecurity. I mean, this is a really important field that we have. It's about our future, our survival. So this is a field where we really need more research. And we can state that 127 million more people experience moderate to severe food insecurity. And also, under a 2 degrees Celsius scenario, nearly 525 million additional people projected to experience food insecurity. So the trend we see is concerning. And please go back to the report to read up on the details on this. We can really say that the increasing temperatures jeopardizes food security. This is a bit provoking, I think. We look into this and follow also the fossil fuel companies, and we can see that the largest fossil fuel companies has continued to expand their production plans, even though, of course, they have access to the reports on how fossil fuel also impacts human health. The numbers are really concerning when we talk about people who are ill, how people also die from air pollution-related diseases. And as always, climate change comes as an extra impact on problems already perceived by the most vulnerable, both the most vulnerable people, but also the most vulnerable regions. And I mean, all the series you can see here, 572 billion US dollars, that's a lot, are invested by private banks to fossil fuel lending, and that was across 2017 to 2021. That's enormous. And also, many countries subsidize fossil fuels heavily, and that is also a concerning trend that you can read up on in the Lancet Countdown report. And then also, of course, I touched upon it saying vulnerabilities. There are many examples of inequities, and most low HDI countries, their households rely on burning or polluting biomass, and just 2.3% of electricity comes from clean renewables, and that's very different from high HDI countries, where it's 7.5%. So the inequities are there, also threatening to increase gaps. And then also when you look at labor capacity loss from heat exposure, affected low and medium HDI countries the most. And this is also one of the points where inequities are exacerbated. Then we should also look at ourselves, those of us who work in the health sector. We are sort of the front line when it comes to protect people from falling ill, but also curing, of course. But at the same time, we are, as health sector, one of the large emitters. 4.6% of all greenhouse gas emissions came from the healthcare sector, and also associated air pollution that resulted in loss of 4 million years of healthy lives. We surveyed 525 cities, and 27% of those cities also said that they had major concerns over the health system being overwhelmed by climate change health impacts. So it's also a concern that we have within the health systems in those cities we surveyed. I want to just finish by saying something positive, because it is actually a very dark picture that we can see from reading the Lancet Countdown report, also following trends. We would like to see a positive development everywhere, but we don't. But we can see small signs, that small glimpse that may give us some hope at least. And we can see that 90% of the growth in electricity capacity came from renewable energy, and also the global investment in clean energy grew 50% in 2022. And then also let's hope that transitioning from fossil fuels and accelerating clean renewable energy will happen, because if it does, we can prevent up to 2 million deaths from each year from that. Please look into the details. I will not go into that because of the short time. And low carbon diets, when we talk about food, would also curb agriculture emissions and have the potential to prevent 7.8 million deaths every year. So, Ilona?
Yeah, now it's time to move on without further ado, I guess. So our first session that is on temperature, which will be kindly moderated by Professors Bertil Forsberg and Dr. Christofer Åström from Umeå University. And just while you're moving here, I leave this slide here to thank everyone who has been involved, and thank you all, also the co-conveners, moderators, organizers, and Amanda Waldorf for keeping so good track of us.
Absolutely. Thank you so much.
And,
over to you.
Over to you.
Thank you. We are very happy to be invited here to moderate this session. I'm Bertil Forsberg. I'm Professor of Environmental Medicine at Umeå University. And this is?
Christofer Åström, and I'm a doctor and a researcher in environmental epidemiology in Umeå.
And we have two excellent speakers for this session. And we have decided with some negotiations to save the discussion and the questions to the end when you have listened to both presenters. And the presenters are?
Yeah. Our first presenter today is Markku Rummukainen, which is a professor of climatology at Lund University, where he works with the development, the evaluation and application of climate and Earth system models. And along with being a professor is, among other things, an advisor of climate at the SMHI.
And sitting together with him is Jan Semenza. He's an expert in environmental epidemiology. He has been working with studies on climate change and health in around 25 or maybe more than 25 years. He's been working at the US CDC, and maybe you also know him from the European ECDC here in Stockholm. He's now working on research projects on climate drivers of transmission of infectious diseases, and he is working at the University of Heidelberg and Umeå University.
Yeah, with that we welcome Markku as the first presenter.
Good morning. And 4 days ago, according to preliminary data from the European Climate Change Service Copernicus, the global mean temperature compared to pre-industrial reached the 2-degree limit. Now, to do that one day doesn't mean that the Earth has warmed by 2 degrees, but it is still an iconic reminder of where we are and where we are heading. Of course, the 2023 as a whole has been a very exciting, dramatic year in terms of weather and climate. We have seen major heat waves, we have seen extremely high sea surface temperatures, and a lot of other things. Our warming world. Well, first of all, we are in a already warm world which has warmed up. You have certainly seen many graphs like this that shows the global mean temperature compared to some reference period, in this case 1954-1980, which is often used in the US. The data is from NASA. And well, in this graph, the blue years are colder than 5180 average, and the yellow-red ones are years which have been warmer than the 5180 year average. And as we all have read, heard, seen, experienced, measured perhaps, the Earth has warmed up by somewhere between 1.1 and 1.2 degrees centigrade during this period. 1.1, 1.2, it depends on which periods we exactly use, if it's the last 10-year period, the last year or something like that, but more than a degree is a good estimate on that. And of course, as was already mentioned, it is not just about temperature. The
global mean temperature is sort of a shorthand for a lot of things that happen in the climate system, in the oceans, in the atmosphere, on land, in the biosphere, and also in human societies, of course. Two examples, sea level rise. Sea level rises because of the warming, because of the ocean heat expansion of the water and melting ice on land. And as you can see, just as the temperature change, temperature rise is not uniform on the globe, faster on the Arctic region, faster over land than over ocean. The same also applies for precipitation, as we have just seen, and it also applies to sea level rise. The rise is faster in some regions than other ones because of how the climate system works, how the physical response of the climate system is to enhanced greenhouse gas warming because of climate emissions, greenhouse gas emissions and climate warming. The other graph, this is the Sweden mean temperature from the SMHI over the past 156 years or so. And it again brings forth the message that climate change is not as large everywhere. In Sweden, over this period, for example, according to the Swedish measurements, the Sweden mean warming has been almost 2 degrees centigrade, which is about double the global mean temperature warming over this period. And indeed, as you have seen, as mentioned, temperature rise, temperature increase over land is larger than over ocean, with the Arctic Ocean as an exception. And the temperature rise over land thus is larger pretty much everywhere than the global mean warming. So for example, because health impact, so the climate adaptation response, it's not really responding to the number of the global mean warming. It has to respond to the number of the local and regional warming, precipitation change, sea level rise, and so forth. Also, the hot extremes have been increased, and this is now repetition. But it does very clearly bring forth that compared to what science could say 5-10 years ago, when we said something like, well, warm extremes are expected to rise, we are not sure if we see that yet, there's a lot of variability compared to signals that are expected. But now the connection has been made in a very robust way in many regions. So the hot extremes, or the heat extremes, including heat waves, we can talk about the length, or the intensity, or the frequency, have increased worldwide. The confidence on the increase or change with the dots everywhere, it sort of associated with the amount of data, how far back we can go with good data about the variability in the region. The greater the variability, the greater the signal needs to be, but also that there may be regions where the signal may not be even expected, or whether it's increasing or decreasing. What also is more common is what could be called, I don't know if other people do, extreme extremes. They are things that in many cases would have been very unlikely to occur but have occurred. Heat waves in this summer, the heat wave in Southern Europe, for example, North Africa, China, are examples. We can go back to North America a couple of years ago, we can go back to Siberia a couple of years ago, we can go to Pakistan, we can go everywhere in the world. There's a research consortium called the World Weather Attribution that looks when such an extreme or extreme occurs, how much more likely has it become because of the global warming that has occurred already. In some cases, the likelihood may have increased by 600 times if you look at one of the major heat waves. In some cases, the conclusion is that this could hardly have happened if we didn't have the global warming ongoing in the background. A recent example, the 3 years of low rainfall and higher temperature from Syria and Iraq and also nearby regions, which of course has left its mark on livelihoods and people and nature in the region. But in this case, the likelihood of such an event to occur has increased by a factor of 25 because of climate change. and of course will become more commonplace or more likely with continued warming. And again, the extremes again reiterate the importance of being able to respond to the events and the direct and indirect effects that they cause. And where are we headed? Well, our further warming world. We are now at 1.1, 1.2 degree centigrade global mean temperature increase in the pre-industrial, which also is higher than probably a very long time ago. If the world would continue or had continued as it did in the past of high reliance on fossil fuels, those systems, and so on and so forth, then we would have been heading towards 5 to 6 degree global mean temperature rise by 2100 to be continued beyond to the next century or so. Now, we are not in this development anymore. Rather, when we look at what the countries of the world have decided and are implementing climate measures, climate policies, climate measures, climate instruments, this is estimated to lead to somewhere maybe just below 3 degree global mean temperature rise by 2100, probably to be continued then beyond to the next century or so. And this is perhaps the best estimate of where we are heading as the world today. Now, the countries have also made various kind of pledges and commitments, and they have set things what they will do also in the long term, sort of net zero strategies and so forth, which are quite shaky because there are not, in many cases, there are no decisions in place for these. It's not clear how these targets would be met and so forth and so forth. But if everything that has been said by every country of the world would be met in reality, then the global warming would be going towards around 2 degrees centigrade, maybe just below. But this is shaky, and the if maybe should have been in capitals on the slide. And of course, this compares or should be compared to the Paris Agreement from 2015, where the countries of the world agreed that the global climate ambition goal should be to keep the global mean temperature rise at well below 2 degrees centigrade, whatever it now means, compared to pre-industrial. And there should be an ambition to aim at keeping the global mean temperature at maximum 1.5 degrees centigrade, which has become de facto goal in most contexts. We are talking about 1.5, we are aiming at 1.5, and so forth. And of course, well, it's good that we are not going towards 5 to 6 degrees centigrade. Excellent. But we are still far from going towards or trying to reach to the Paris Agreement goals, which in turn would not prohibit or save us from all the climate impacts or the needs for climate adaptation or to handle the so-called loss and damage. And indeed, we are heading steadily towards 1.5 degrees, and pretty much regardless what kind of emission scenario or climate ambition level we are considering, we will reach the 1.5 degree limit in terms of global warming, not just a one-day average or one-month average or so forth, sometime in the early 2030s. It doesn't have to mean that we stay above 1.5. There are still ways, says the science, to sort of do an overshoot perhaps and then come back to 1.5 or even below. Of course, it requires additional measures, just cutting the emissions or net negative emissions and so forth. From the IPCC report from this is 2022, that if you look at the goal at keeping the global mean temperature rise at 1.5 and at 50% probability, there's always a probability of fix when you compare temperature goals and emission scenarios or emission pathways. With no overshoot or with a limit overshoot, which means up to 1/10 of a degree over a couple of decades or so. in this case, to do sort of an efficient emission reduction pathway or least cost alternative, with the assumptions that one dares to make about technological development, consumption, policy, and so forth, and to keep within the so-called carbon budget, so the total amount of emissions over time from the past, the present, and the future. So then the pathway would be characterized, and all this has to sort of fall in place. If one milestone is not succeeded with, then you have to redo all the other milestones as well, because the total amount. Peak emissions before 2025. Greenhouse gas emissions should be reduced by 2030 with around 40% compared to 2019. The reference year is important. Greenhouse gas emission reductions to 2050 by more than 80%. Net zero carbon dioxide, which means that some methane emissions, nitrous oxide emissions will still be in play in the early 2050s. And this has to be topped by net negative emissions after the net zero, in this case by that amount. And of course, you can do variations. This one doing more in the beginning and less in the more in the beginning, more into further in time, doing higher net negative emissions under some assumptions and so forth. But the point here is, if we miss the 2030 target, then of course the remaining milestones become so much more challenging, if you like. Now, the United Nations Framework Convention on Climate Change has recently compiled the latest nationally determined contributions or climate plans of the countries, the countries of the world, if you like, the most recent ones. And there are a lot of numbers in this compilation, depends if you look at the conditional or the unconditional and so forth. But the nationally determined contributions to date, what the countries of the world have said to each other, is that the emissions would peak, well, fair assumption before 2030, but the global greenhouse emissions at 2030 would be somewhere around 2% lower compared to 2019. Plus or minus, if you do in the unconditional assumptions and so forth, you get a couple of more percentage units in there, but nowhere near the 43%. And well, these NDCs by themselves do not say so much more about the longer term. There are other instruments for that. Climate change and health. Well, yes, with the increase in climate change, we have increase in ill health, insecurity, decrease in well-being, disease burden, and so forth, related to changes in food security, nutrition. Quality of many crops will suffer with increasing temperature, for example. Water security will strike different in different regions. Exposure to the extremes, which has been mentioned, heat, flooding, and burdens of climate-sensitive, well, disease carriers and diseases and mediums and so forth. And also climate change is one driver of conflicts. It doesn't directly necessarily cause conflicts, but it increases the tension if we have dry conditions or food insecurity and so forth and so forth. There are also synergies between action in climate and health. Sustainable food systems, which has been mentioned, healthier diets, can save a lot of emissions. Improved social protection, social safety nets, health systems can provide for climate adaptation at least. Clean energy, reduce air pollution, reduce climate impact. And these perhaps are not sort of utilized or sort of spoken enough as yet, taking the synergies also into play in health. Also, climate adaptation more general, of course, can ameliorate or lessen the negative impacts in many cases. And looking at the studies, sometimes adaptation is included, sometimes it's not included, and one sees then it's in the numbers. And this indeed, the Sustainable Development Goals, however difficult they might be to achieve, it is a coupled network of different things. Starting from the climate side, we have the climate action goal, but it is both inherent, it's sort of a prerequisite of reaching many of the other goals, like no poverty, zero hunger, good health and well-being, ecosystems and so forth. But they also, if the world does sustainable cities, sustainable consumption, clean energy, and so forth, that will also provide so much towards the climate goal as well. And these connections can also be one of the important keys to actually doing effective action in many cases. Well, finally, it's clear that all emissions that continue will further increase warming, sea level rise, enhance extremes, make extreme extremes less extreme extremes, even though they will be very extreme extremes if you follow. I'm sure you do. And this in turn will increase the risks of negative impacts, and it will also mean that adaptation becomes less efficient to be used to deal with the increasing impacts. Adaptation limits on different areas will sort of close in. Adaptation will no longer be effective in dealing, no matter how much money one throws at it. And there are solutions. There are solutions to reduce emissions. Those solutions do not cost. They, in many cases, are cheaper than continuing as we have done. The benefits of, for example, solutions that also provide for better health are enormous. But the solutions, we still lack both the scale and we lack the pace of putting these solutions in action to really continue bending the curve from where we are heading to where we have said we would like to be heading. Thank you.
Thank you, Markku. As Bertil mentioned earlier, we will save the questions to the end. So we welcome Jan Semenza to the stage.
Thank you. It's great to be here. Thanks for the invite for speaking here today. Thanks, Bertil and Christofer, for moderating the session. I've been asked to speak about temperature, and so I would like to show some of these relationships between temperature and health effects. And I'll be touching on communicable diseases and non-communicable diseases because the effects are quite far-reaching. Let me see if I can operate this. So I don't want to go through this slide here. This is IPCC. This just came out a few months ago. You see how temperature had been observed over the years here. This is almost 200 years worth of data. And then you have experienced this steady increase of temperature. We have reached something like 1.14 degrees over pre-industrial times now currently. So this temperature is going up and up throughout the years. You can see the color bar here at the bottom where you see it's getting warmer. But we spoke about that already. So the thing I would like to touch on is today the health effects of those temperatures. And you can see here the spinning wheel of these climatic effects and what that leads to when it comes to effects in the environment, like air pollution, changes in vector quality, allergens, water quality, and so on. And then you can see the health effects that are associated with these climatic effects. And actually, I just gave a talk about this in Florence last week, where we went through every single aspect of these health effects. And obviously, we don't have time to do that today. So I'd just like to touch on some of these health effects and go through some of these impacts of temperature and how to relate to these health outcomes. Let's start with heat-related mortality. And then I'll touch on some other ones as well, and maybe we can discuss the other ones that I won't be able to mention today. It turns out that these heat health effects were addressed in the most recent Science edition here in September, where they looked at heat and health. And it's a worthwhile issue to look at. And as Bertil mentioned earlier, I got involved in this probably almost 30 years ago now, when I was worked at CDC, the Centers for Disease Control in Atlanta, and I was asked to investigate a heat wave in Chicago. And heat wave in Chicago, what does that have to do with public health? I did not really relate to what that would mean in health terms. I, at the time, had isolated the heat shock receptor. I knew everything on a molecular level, what heat does to cells. But what does it do to populations? In fact, nobody knew. It was a new field. And so here in this situation, you see that an inversion had locked hot air over the city of Chicago. And then suddenly you saw this increase in heat and humidity. This in here is the heat index, which is this bizarre term, a combination of heat and humidity. And you see it skyrocketed here. And then two or 3 days later, you saw an increase in heat-related mortality. So people were dying from heart attacks, heat exhaustion, and other health effects. And we saw this spike in mortality here a few days later. So I was asked to investigate the underlying reasons for this increase in mortality, because there was a political controversy between the mayor in Chicago, Richard Daley, and the medical examiner who classified all these deaths as heat-related. The mayor got upset. Just because it's hot out doesn't mean that all these deaths are heat-related. So we were supposed to investigate what was going on. And we set up a big, complicated case control study where we evaluate a lot of different factors. But let's look at just one of these outcomes, which is social contacts. And we saw that people who had friends, who had neighbors, who were embedded in social networks, they were less likely to die from heat-related mortality based on our case control study, where we interviewed something like 700 people in the city of Chicago. You can see that the odds ratio here is protective for these social variables. But if you live alone, if you're isolated, that risk goes up. So even if you have a pet, that helps you because you go out and speak with the neighbors. And so this is just one of the factors that we looked at, but this is the outcome that we observed. If you don't have friends and if you don't connect it with social networks, you're more likely to be brought to mass burial. All these are the people that were socially isolated in the United States during that heat wave and were brought to mass burial because nobody knew them. This is what it means to be socially isolated at risk in the United States due to these heat waves. So what can we do about this? It turns out that the information from the heat wave in Chicago was used for heat health action plans. So we knew who is at risk and how you can target them. We had a line listing of all these variables of who would die during a heat wave. And this information was incorporated into these heat health action plans in the United States that was rolled out in every city in the United States to reduce the impact of heat-related mortality. Because guess what? Nobody has to die from heat. This is entirely preventable. And it worked really well. A heat wave hit Chicago and that area later on, and there was much less mortality as a result of these heat plants. Then what happened in Europe? In Europe in 2003, there was a big heat wave. And this is a statistical outlier, as you can see on this graph here. So here you have the frequency of the different types of heat waves with the temperature, and 2003 was an extreme outlier at the time. And as a result, we had 70,000 people that died in Europe because of the 2003 heat wave. And then the Europeans woke up and they realized that they need to do something about heat waves also, and they implemented these heat health early warning systems as well, with these warning forecasts, risk conditions, alerts, dissemination of alerts, and communication. In Chicago at the time, they told people, it's hot, it's hot, it's hot. There's no information in this. Everybody knew it was hot. Here we told them, if it's hot, you need to take it easy, drink cool, stay cool, go to an air-conditioned place, don't exert yourself. You need to do something about this. This is what we learned from these investigations. You need to communicate appropriately. So the Europeans now implemented these heat health action plans throughout Europe, and the heat wave in 2006 in Europe had much lower heat mortality as a result. And then what happened? 2022 happened. This was the hottest period ever recorded at the time. This probably has been overtaken now by 2023. And here, 61,000 people died in Europe, predominantly here in Southern Europe, in Italy and Spain. And the disease, the mortality was staggering, with 61,000 people that died. You know, I happen to travel a lot, and I'm busy with this and that and stuff. Did you hear about that? I missed that. I must have been out of town when this happened, because this corresponds to 300 airplanes crashing, and I completely missed the news. Did anyone tell me about that? I didn't hear about that. Anyone else? Nobody talks about this. 61,000 people die, and everybody's sound asleep at the switch. These heat health action plans are not working. Something is happening here that we need to get going to implement these kind of interventions to stop people from dying. So in 2003, there were 70,000 people that had died. We implemented heat health action plans. But even if we have these heat health action plans, it's not working. We still have 61,000 people that died just last year. And like 80,000 in Italy, 11,000 in Spain, and so on. So this is unacceptable. We need to do something about that. And this is what Maria just alluded to. This is hot off the press. I'm speaking about heat, right? So this is hot off the press. This is the report that we just released a couple of days ago. And this one here looks at the population that is at risk. It turns out that heat is increasing, but we also have an aging of the population. It's like a synergistic effect where these people are more at risk, not just because it's hot out, because we also have more vulnerable individuals, because people are getting older. And you can see that the curves are going up and up and up, with 85% increase in risk, as Maria mentioned earlier. This is obviously an age issue, but it's also an urban design issue, because our urban centers tend to be hotter than the surrounding areas. We call this the urban heat island effect, which creates these hot environments. And as part of the Lancet countdown in Europe, so there is a Lancet global countdown and one European. This one here is now for the European one. We look at adaptation options, try to cool down the urban environments with greening, planting more trees, more shade, so people don't get so hot in these urban environments. The next one is a heat wave so once it gets hot, there's more air and more water that evaporates from the ocean, because the heat capacity increases with elevated temperature. So once it gets warmer, there is more temperature gets up into the air, and that water has to come down. And so we had this extreme rain event in northeastern Europe, where over 200 people died due to flooding. And I won't go into details here, because I know that Sarah is going to talk about water later on this afternoon. But temperature leads to these extreme precipitation events in an indirect way as well. Then let's talk about infectious diseases. This is some elegant work that was done by the Umeå group with Zia Farok in particular, and the whole Umeå group that was involved in this. And let's look at West Nile. So it turns out that there is a virus that circulates among birds. So it's introduced here with a wild bird, and so that wild bird infects another bird with this virus due to these mosquitoes that bite birds, and then so you have this transmission cycle among these domestic birds. And then suddenly you have a bridge vector, like a bridge mosquito, that likes both birds and humans. And so it picks up the virus from a bird and transfers it over to us. And then people can potentially die from that. It's a very severe neurological disease. And then people can be infected as a dead-end host. So we don't contribute to the transmission, but we can be infected by this virus, the West Nile virus. This is the most recent map from the European Centers for Disease Control, ECDC. And you can see here the distribution of West Nile fever cases throughout southeastern Europe in particular, but in general here in the Mediterranean area. And you can also see the yellow dots here, which are birds or horses that are affected as well. And so, as I mentioned, Zia Farok here in Umeå investigated the epidemiology of West Nile fever cases in Europe, and he noticed this big spike in 2018, and he used artificial intelligence to teach the computer. He fed all this information into the computer to teach the computer what kind of variables are predictive of these type of epidemics. And you can see that the mean temperature of the warmest quarter, temperature seasonality, and all these temperature variables were strongly predictive of these West Nile fever cases in Europe. And he particularly noticed then if you compare 2018, which was this extreme year, listed here in blue, you can see that down here in blue, compared to a normal year, for example, 2017, that the maximum temperature of the spring, so if you look at spring temperature, that is a strong predictor of this extreme outbreak that we had in 2018. You can see that this is statistically different. So the mean temperature or the max temperature from the spring is different from normal outbreaks. So the good news about this is that we can use spring temperature as an early warning signal what's going to happen later on in the season, and then we can potentially intervene and tell people to protect themselves from mosquitoes, stay away from potential exposures to get those West Nile fever cases down. And so this paper is also hot off the press. This is a projection study that Zia did, where we looked at different type of scenarios. So you want to read this vertically here. So this is a low scenario, medium scenario, and extremely high. And these are the different decades. And you can see how these yellow areas increase, and which basically indicates that now even in Germany, we have a risk for West Nile fever due to the warming, because the conditions become more and more suitable for these type of infections. And the bad news about this is that the blood banks are potentially at risk, because 80% of West Nile fever cases are asymptomatic. So you have an individual who doesn't even know that they're infected. They go and give a blood sample, and then the entire blood bank is contaminated, and that can lead to infections as well. So there are serious public health implications to this. Another one is waterborne diseases, and in this case, we ranked all infectious diseases in Europe to see whether they are strongly associated with climate change or not. And so we grouped them into these three categories. On the y-axis here, they're highly associated with climate and climate change or not. And then we mapped that against the impact on society to evaluate the infectious diseases that are under decent surveillance or suboptimal surveillance when it comes to climate change. And you can see in this slide that certain infectious diseases that are highlighted in bold, the surveillance systems in Europe was suboptimal. After we published this paper, we did in fact see that the European Commission decided to put TBE under surveillance and Lyme borreliosis. So now things have changed in Europe, and these diseases are now mandatory to be reported on a continental scale. But there is one of them that is not, and that is Vibrio infections. And it turns out that these Vibrio infections are bacteria that live in marine environments. And it turns out that a lot of Swedes go to the beaches during the summer, but they can potentially get infected with these Vibrio infection bacteria if they have a wound. And we do in fact see fatal cases of these wound infections even in Sweden. And the if we have a disease for which there is no surveillance, how can we potentially protect the public from these type of impacts? So let's imagine you have climate change that leads to increase in sea surface temperature in the Baltic, for example, like an environmental signal like sea surface temperature, and that leads to direct exposures, indirect exposures, or socioeconomic impacts. And then in public health, we usually measure the impact at the very end of this causal chain, and that's what we do surveillance. But let's imagine that we actually monitor upstream what is happening before we have these health outcomes by measuring sea surface temperature. And that's exactly what we are trying to do by measuring the sea surface temperature that indicates that we need to set up surveillance systems in order to pick up that first case, in order to respond to suppress that epidemiologic curve. And that's exactly what we built at ECDC. We built this Vibrio map viewer where we monitor the sea surface temperature globally throughout the world, but we now calibrate this just for the Baltic Sea when people go to the beach during the summer months. And we are concerned about these Vibrio bacteria that thrive if the temperature passes 15 degrees Celsius and if the salt content is relatively low, brackish water, and they can lead to serious wound infections, gastroenteritis, septicemia, and amputations. And we set up this system where we monitor sea surface temperature and salinity in Europe to indicate which bays are at risk for these potential infections. And when we saw this signal in 2014, we were able to see that this corresponded to an epidemiologic signal. And when we built the exposure response curve, we saw that there's a very strong relationship between the risk and of these infections and sea surface temperature. So now we can use this as the early warning system to tell people to stay out of that beach that is now very suitable for these type of infections and protect the health from the public. The bad news is that if we project that risk forward in time, we will see an increased risk over the time, particularly here in the Baltics. You can see the different months here illustrated. These are the warmer months of the year, so medium warmer months, but then also the colder months, and they all show an increase in the suitability for these type of Vibrio infections coming down the pipes due to climate change. So in conclusion, heat is a major issue for public health because of the aging population here in Europe and because of urbanization. So we need to do something. We need to improve our systems because despite our heat health action plans, we still have 61,000 people that die, which is entirely, totally unacceptable. And this needs to be addressed. Then we see a number of infectious diseases that are of concern. I could have touched on many more, but they're going to cut me off in a second. I'm sitting there with the red sign already. So foodborne, waterborne, vector-borne diseases are a concern, but we can build these early warning systems by monitoring epidemic precursors of disease before we see the impact, and then we can intervene very effectively to prevent people from getting affected or dying from these type of climatic effects like temperature. And this is the most important slide. Here are all the people that contributed to the work, particularly Joachim Rocklöv and Zia and other people that have contributed to this work over the years. And any questions, please send me an email.
Thank you. Sorry not being able to give you more minutes, but we have to give the audience a possibility to ask questions. Markku, could you please join us? Well, the floor is now open for questions. Just raise your hand. We'll try to see. And we could say that there are microphones now in the roof. So yes.
Thank you for a very nice presentation. I wonder about, in the Nordic context, what are the major health threats in relation to climate change?
Yeah, so I illustrated the health impacts from heat waves in the southern part of Europe, but it turns out that we in Scandinavia, we are at risk also. In fact, Christofer is one of the world experts on this topic, because it turns out that we are less acclimated to the heat. So heat waves are particularly dangerous if they happen earlier in the season because nobody's used to the heat yet. But we Swedes are at risk because we are further north, we're not used to the heat. Our infrastructure isn't built for these type of impacts, so we are at increased risk as well. So Christofer, you might want to address this because this is your cup of tea.
Yeah, and also we can see, we have done studies within Sweden that we also see that the further north, even in Sweden, we get, the higher the impacts if you look at the same temperatures. And if you look globally, you can see that the temperature at which risk starts to increase is roughly around the same percentile of temperature. So it's when you're moving to an extreme area, regardless of what temperature regime you live in. That's when things start to happen.
Yes, Mark. Petter?
I have a question. I was intrigued by the concept of negative emissions. What's that?
Well, it's taking carbon dioxide from the atmosphere and storing it, for example, below ground or using it as a raw material. Well, below ground, otherwise it's net zero. It is being done, many people don't think about it, by afforestation, reforestation and forest management that provides negative emissions by increasing carbon sinks in parts of the world. But then we have the direct air capture, for example, sucking in air, extracting carbon dioxide, or using biofuels compared to carbon CCS, carbon capture and storage. But basically it's taking carbon dioxide from the air and not letting it go back there. So reversing emissions to negative emissions. It's unclear whether it will be possible to do it at scale over this time scale. So nobody, at least in climate science, nobody is saying that's a solution, but it might be a must to some extent if emissions do not, or if direct emissions do not sort of are reduced faster than today's pace.
Well, thank you very much. I was wondering, you're talking very much about the health effects that we see now, but do you have any methods, and what's your assessment of the health effects further on? Because when we talk about these changes, it's often you have the youth perspective and future generations, where the situation will be very difficult. Do you have any scientific tools to assess these risks and the situation that we would have then?
Yeah, a great question. And obviously this is very difficult, but what we do, we train the models to predict the current situations. And then with this kind of a machine learning, you can project that forward in time by changing one variable at a time. And in this case, temperature, right? You can see what would a temperature increase have on these health outcomes. But guess what? It's not just temperature that's changing, right? So how do you take into account all the socio-demographic changes, all the economic changes, environmental changes, you name it, right? It's so multifactorial that it's difficult to project that forward in time. We use 2 or 3 of these variables maybe, but it's impossible basically to come up with a proper projection to see what's going to happen because nobody can predict the future, right? We would like to have a crystal ball, but nobody does. And so we're doing our best, but it's difficult.
Well, may I?
Yeah.
I mean, I actually think that we could predict, we can actually choose the future to some degree. I mean, when it comes to emissions and global warming, I mean, we can choose which path we choose to take. We can't predict which path we will take, but we could sort of at least reduce the uncertainties and constrain sort of the alternative paths and so forth. And also, I mean, what you were saying, so sort of explicitly at the adaptation, so that the response will be important for what the actual impact in the end will be. And that's also, of course, very difficult to model. We can't predict the adaptation response in the world, even though we know that there are possibilities to sort of work on that.
Erik?
I have a question related to the heat, not heat waves, but climate change when it comes to temperature, which is already occurring, which is very nice to show here. But do we also adapt the Swedish agriculture or the world's agriculture, meaning that if there is a higher temperature, do we also adjust the crops and how we perform agriculture and how we grow our whatever we are growing, meaning that's an opportunity to adapt also in order to increase crops or to more efficient crops. Where is that? I'm sure there are discussions ongoing how we can, we have to adapt.
It's an area of research, of course. I mean, climate impacts on food production and crops and so forth and so forth. And I think what the science says that there will be very different impacts on agriculture depending which part of the world one looks at, which of course it's not enough to produce enough food in the world, which we do today already. It's also a distributional impact, or sort of if we get the food from here to here. Yes, in order more heat-tolerant crops, for example, crops that still have the nutritional content compared to if you grow today's crops, wheat, for example, in future climates and so forth. But I think that one thing which is often overlooked is what we produce. I mean, a lot of land, as we all know, is used for feed rather than, well, food directly. It's food indirectly, and that's where a lot of the potential is to sort of make adaptation of the agriculture, keeping the food production compared to if we continue with today's production patterns and consumption and diets and so forth. But it's an important question, and again, like in global mean temperature, it's enough to look at the global total, but it's look at the regional impacts and effects and so forth.
And just to add to that, I just came back from Italy, as I mentioned, and this colleague he has a farm in the southern part of Italy, and over the last 3 years they have had 0 olives grow because of the heat. Italy without olives, it's a concept that doesn't work, and so this is a very serious issue. So I totally agree with you. In the US, they just gave this big science prize to this Ethiopian researcher who developed drought-resistant grains to have crops that can sustain the kind of heat. But I'm with you, it is a huge issue.
He's partly Italian.
Annica.
Yes, I was just very intrigued by this non-response to the 2022 heat wave. So do you have any idea what went wrong there in the communication versus reaction to the...
Great question. So, like we are so excited about the ER, right? The emergency room where all the action happens. Nobody pays attention to prevention, because once you prevent a death, you have maneuvered yourself out of a case because the case doesn't exist. And so nobody's interested in statistical deaths. People are interested in 300 airplanes that would crash, that would catch the news. Politicians will get fired, technicians will get fired. I mean, the implications will be huge. But if you have 60,000 statistical deaths, nothing happens because the politicians are sound asleep, the public is sound asleep, and nobody pays attention. So I think that is the issue, and how do we overcome that? That is my question.
Maybe also because the numbers are shown a couple of months later than
That's right, yeah.
I think that was also this year that people were, it's a bit hot, but are people really dying from this? Nobody could really see that at the moment, so maybe it's like you say, it comes later.
The silent deaths.
But one more question, and then I will take...
Brilliant. Thank you both for your excellent talks. I'm interested in health and social care system resilience in extreme heat. And talking from a UK perspective, 90% of NHS hospitals are susceptible to overheating. Lots of the infrastructure just isn't built for these circumstances. And often we see that GP practices, care homes, hospitals are built in urban areas which are most susceptible to urban heat effects. And I'm just interested from both of you, what sort of tangible and practical things you think that sort of health and social care systems can take to protect themselves and also to build resilience in the face of extreme heat.
Yeah. I call this lateral public health. I don't know if you see my email. So lateral is thinking outside the box. We need to get away from this vertical way of executing public health programs. They're very effective of eradication, smallpox, or eliminate polio. You eliminate one disease at a time. The problem is that the kid won't get polio. It's going to die from other poverty-related issues like respiratory disease and so on. So we need to completely revamp the public health structures by creating these a system that connects the public to these public health issues and increase social networks among groups. So when it comes to heat-related mortality, the vulnerable groups are the socially isolated. They need to be reconnected with society, and you need to set up a system where you can reach out to these individuals, engage them to make sure that they're protected from the impacts. So it's a different type of an approach as opposed to the vertical programs. You have to have a horizontal program. And I've done a number of kind of these projects in different places of the world. They are difficult. They are much more difficult. Vertical programs, they're effective, and the funder is going to get the bang for the buck, but they never solve the underlying issues that kill people in the end, right? So we need to rethink. So it's something that we need to retool.
I will take the opportunity as the co-chair to ask the last question, because we have to move on, and it's for Markku. Your first slide was about the heating that we had today with more than 2 degrees warming.
In Sweden.
Was that in Sweden? No, in the last week we had news about this. But I was thinking, how do we talk about this from a climate change perspective, since the people don't believe in climate change says, oh, we had a cold month now, then it can't mean that we have climate change. How should we talk about this? This is the warmest month ever. But in the same fashion, we can't use that as the single argument that climate change is rapidly increasing, because it could be an outlier. How do you think we should communicate around that so that our own arguments isn't used against us, so we don't exaggerate?
Well, 2 things, I suppose. One is that there will always be people who don't believe in something. Yeah. And climate change is not unique in that perspective. I think there's been a lot of progress in awareness of climate changing. I think studies show that in our part of the world, for example, people are mindful of climate change. Of course, the elections come, it's not climate change that will decide the elections, it's School of Vård and Omsorg, eller one says that, and some other things. But I also think that there is a gap and difficulty in really relating what it's all about, depending how protected one is, how much one experiences. I mean, if you go elsewhere in the world, or somewhere else in the world, I mean, people will much more first-hand experience the difference. For example, you mentioned about the olive crops in Italy, or drought somewhere else in the world, and whatever it is. And I think that's a bit of a challenge. That what is our relation to climate change here in Sweden, for example, unless you have been in a city that has been flooded over, which start to be happening right now, or lost 50 meters of your coastline in southern Sweden, for example, when a storm comes and whatever. So there is, intellectually you can of course do the math and look at the data and say that, well, it's getting warmer and it's more than usual and so on. But really to have this more emotional connection, but I think I don't have an answer on that.
No. Thanks for all the good questions, and thank you, Jan and Markku. And we'll leave over to the
Thank you so much for an excellent session, both to the moderators and to the speakers. And now it's time to move on to our next session, which is co-moderated by myself, but primarily by Sarah Steimer from Stockholm University. She's an assistant professor there working with air pollution. We also have a third co-convener, Professor Tobias Alfven from Karolinska, but he was unfortunately not able to be here today, but he sends his warm regards. We have divided the work so that Sarah will do all the heavy lifting and I just get to keep the time. So the floor is yours.
Okay, yeah, hello to the second session on air as a topic. We will do things very slightly different from the previous session in that we will have some questions already after the first presentation. Yes, so air. Of course, there is a very direct link between the composition of air and health through air quality, but then there's also the more indirect link, as we've already heard, since the composition of air affects the climate, which can affect health. And the interplay of these different factors is what is going to be the topic of this session. So let me now introduce our first speaker, Professor Annica Ekman from the Department of Meteorology at Stockholm University. She is an expert in clouds and aerosol particles and how they affect the climate. And yes, the floor is yours.
Thank you, Sarah, and thanks to the committee for inviting me here to talk today. So yes, as the title says, I will talk about the link between air quality and climate. And I will talk about the link that is maybe not so often the focus of climate when you talk about climate change. And don't get me wrong, greenhouse gases, carbon dioxide is driving the warming of the climate at the moment, but this is an effect that is sort of modulating the warming to some extent. So we have seen past temperature change now in different graphs, and then we also have here some future projections. So we can see that the temperature has increased, and now where we are here we have a warming of a bit more than 1 degree. And then if we look at the future, we have different scenarios that we can go along depending on how much greenhouse gases and other things that we emit. So if we want to stay below the 2-degree climate change target, and preferably within the midterm future, we see that there are in this graph basically only 2 scenarios here that will keep us under this warming. And as Markku said, these scenarios are unfortunately quite unlikely. And they are often referred to as CO2 change or CO2 emission scenarios, but there are other things in here that we don't really see. And the first is something that was discussed here during the last discussion, that we actually, in these 2 scenarios, need negative CO2 emissions. We need to somehow remove carbon dioxide from the air, either through plants or through some carbon capture method that occurs actually that we draw carbon dioxide from the air. And the other thing that we don't see in these scenarios is that there are other emissions than carbon dioxide in here as well. And some of these emissions are so-called short-lived climate forces. And these are chemical compounds that stay in the atmosphere for a relatively short time, but they do affect climate. So we have, for example, we have aerosol particles that are suspensions of solid and liquid particles in air that I'm sure that most of you here are aware of. They have anthropogenic sources, and they stay in the atmosphere for a day or a week or so. And this is then much shorter than carbon dioxide, which is why it's called a short-lived climate forcer. We have ozone that is not emitted directly, but formed in the atmosphere through different anthropogenic emissions. And that has a residence time or lifetime of a week or so. And then we have methane, which is a little bit different compared to the other 2 because it's not directly an air pollutant, but it contributes to air pollution, for example, through forming ozone. And that is also different from the other 2 in that it has a relatively long lifetime. It stays in the atmosphere for 12 years approximately, so it's also considered well mixed in the atmosphere. If we measure the concentrations here or in the Arctic, they're about the same, while if we measure the concentrations of aerosol particles, they're going to be very different. So methane and ozone, they both warm the climate, so they act similarly as carbon dioxide in warming the climate. Aerosol particles, they are very different, but they tend to cool climate, as Ilona also mentioned in the introduction. So there are different types of aerosols, and some of them cool and some of them warm, and most of them cool the climate. So we have, for example, sulfate from different anthropogenic activities, and nitrate from agriculture, for example. So these particle compounds, you can say, reflect solar radiation. And just by reflecting, they will cool climate. They also affect clouds, as Ilona also mentioned in the introduction, and they make clouds more reflective. So that is an additional cooling. But we do also have some aerosols that warm the climate, for example, black carbon or soot from combustion. And it can also be mixed with some other things, such as organic carbon from fires, for example. But if we look as a global average, we do have a cooling of the atmosphere from aerosol particles. And for both aerosol particles and ozone, the interesting thing is that if we change the emissions, because they are short-lived, we will quickly also change their climate effect. So what is the climate effect from these short-lived climate forces? Well, if we look at year 2019, so approximately now, we can see here at the top the total warming that we have currently, which we have said now several times is a bit more than 1 degree. And we have some of it then is coming from the warming due to greenhouse gases, so that is mainly carbon dioxide, but also methane. And if we look at this in terms of watts per square meter, we have a warming that is about, or a forcing that is about 1.7 watts per square meter from anthropogenic anthropogenic carbon dioxide, and about half a watts per square meter from methane. If we look at the other anthropogenic forcers, so here aerosols and tropospheric ozone are included, we can see that tropospheric ozone warms with about half watts per square meter, while the aerosol particles as a global average cool with about 1 watts per square meter. So if we do our calculations here and look at the total effect of these three short-lived climate forces, we can see that they almost cancel out each other. So the take-home message here is basically that the total climate effect of short-lived climate forces depends on the relative abundance that we have of cooling and warming substances. And at the moment, they tend to cancel out each other. But if we start to reduce the cooling substances, such as the aerosol particles, then we will get a warming. It will look like we get a warming because they have currently actually dampened some of the warming that we see from carbon dioxide. And we do want to reduce air pollution, and we do want to reduce the amount of aerosol particles in the atmosphere. So this is probably well known to all of you in here, but aerosol particles that we also call PM, particulate matter, affect health in different ways. So our lungs and our hearts, so the cardiovascular system. Also, tropospheric ozone or ground level ozone affects our health in somewhat similar ways, or similar symptoms at least, that we have problems with our breathing and we get problems with our hearts and so on. And these are maybe a bit old numbers, but they are still very relevant, that we have still problems with air pollution. So tropospheric ozone, for example, we have too high concentrations in cities quite frequently, especially when we go to Southern Europe. And this costs money because we have people that die from it. And there's quite a lot of people that actually die prematurely from this. So just in Sweden, about 7,000 premature deaths every year. So we want to reduce these aerosol particles, and we want to reduce tropospheric ozone. So if we go to the future then, and these will be somewhat complicated figures that I hope I will be able to explain. But here we have carbon dioxide and what we think it will look like in the future if we follow different scenarios that I would call here either the IPCC emissions, so what was used in the last IPCC report, or from a different intercomparison or climate evaluation project. So this was the Arctic Monitoring and Assessment Program that produced a report quite recently, or it should have been released recently, but due to the war in Ukraine, it is unfortunately postponed. But there's a summary available on the web. And this is about short-lived climate forces and how they affect air pollution, health, and climate. So we have different futures here for carbon dioxide. They will, basically most of them will cause a warming. We don't think that the emissions, unfortunately, will decrease unless we go according to this scenario, the SSP1 scenario. So the short-lived climate forces, they also have a very diverse future depending on which path we take. So if we look at methane that warms, we think that it can either go to a warming or like increasing methane emissions in the future or decrease. Sulfur that is currently cooling, we think that the sulfur emissions will generally decrease in the future, either by little or by a lot, because we want to reduce this because of air pollution, basically. Black carbon, we also think that that will mostly decrease either by a little or by a lot. And the same with organic carbon emissions, that it will either decrease by a lot or by a bit more moderate emission decreases. So what I will show now is a comparison of two different emission simulations with two different emission scenarios. So it's the current legislation, that was difficult to say, and maximum feasible reduction. So basically one where we have low emission reductions of short-lived climate forces and one where we decrease them a lot. And the carbon dioxide concentrations in these two scenarios, they follow the same IPCC scenario. So they are the same in the two futures that we see. So this then shows the temperature change relative either to 1995 to 2014 here, or to pre-industrial time, so 1880 to 1920. And we see the 2-degree target here, and the preferably 1.5-degree warming here compared to pre-industrial times. And we can first focus on these diamonds, the black diamonds, and they show the global average warming that we will have then in the future, if we follow either this current legislation or the maximum feasible reduction scenarios. And we can see that these two dots are very similar actually. So does that mean that the air pollutants don't make any difference? Because that was what was different in the two scenarios. So we can then use an emulator, a statistical model, to see how much do different compounds here contribute to the warming. So the blue here, for example, is the carbon dioxide, and that is the same in the two scenarios because we had the same CO2 emissions. If we look at the orange here, which is from sulfate, we can see that that differs. So yes, as I said, we see no clear difference in the total temperature change between the low and the high emission reduction scenario for short-lived climate forces. But we do see a difference that in this smaller reduction of sulfur, we get less apparent warming compared to here. But then we also have other things. We have black carbon in green, and we have methane in blue. And these will, to some extent, balance what we see in terms of the sulfur reduction changes. So emission changes in methane and black carbon, they to some extent compensate for the sulfur emission changes in these two scenarios. So the total warming is about the same, but we have a clear difference actually in terms of how much pollutants we emit. So the health effects, they are here calculated because this was from the AMOP report. We focused on the Arctic and also countries that have observers for the Arctic environment. So this is the low pollution emission scenario, and this is the high. And we can see that in both scenarios, we will actually save a lot of premature deaths. And it is actually much better here in the emission scenario where we do large reductions in all short-lived climate forces. So this is actually a win-win situation if we manage to reduce sulfur and methane and sulfur at the same time. So one thing with aerosols is that they have then a shorter residence time in the atmosphere compared to greenhouse gases, and now this one is supposed to, yes, move. So if we look at the aerosol distribution in space and time, it varies a lot. And this is an animation from NASA. And it's quite simplistic, but we can see also that we have different types of aerosols in different parts of the world. So in white here is, for example, a lot of sulfur over Europe and over North America and over East Asia. While if we look over Africa, for example, we have a lot of biomass burning, so we have a lot of soot and organic carbon. And we also see that, for example, here over India, together with sulfur, because this also comes from residential cooking. We can also see natural aerosol particles, like here over the oceans, where we have a lot of sea salt. But the distribution is very different. Does this also mean that we see different climate impacts if we don't only look at the global average compared to greenhouse gases. So this is then the surface temperature change in the future for the northern hemisphere. We focused on that here because this was also done for the AMAP report. And we have the two futures, either the CLE or the MFR, so the one where we don't reduce the air pollutants so much and where we reduce them a lot. And note here that the temperature trends includes both then trends from increasing carbon dioxide and aerosols. So overall we see a warming everywhere, and it's particularly strong in the Arctic, as was shown before also by Markku, for example. And there is a small difference between these two scenarios. We have more warming on average in the MFR scenario, which then comes from the air pollutants. And they do affect the temperature more over the northern hemisphere than over the southern hemisphere because that's where most of the emissions occur. But we don't see typical hotspots like over, for example, Europe or North America, where we would think that we reduce the emissions a lot. The temperature effect tends to be smoothed out quite a lot, actually, when you look at long time scales. What we do see a more clear difference in is the change in precipitation when we reduce these short-lived climate forces, so aerosols, for example. So you saw before pictures of how the precipitation may change in the future. And this is also the future precipitation over Europe, Southwest Africa, and Southeast Asia, approximately, if we look at year 2050 compared to 2005. And here it's only due to aerosols. And if you remember, we could, from greenhouse gases, see a clear drying over the Mediterranean. But when we reduce aerosols, we actually get instead a wettening of the area. So this will, to some extent, compensate for the drying, and we don't know so well how much it actually compensates. So this is something that Ilona mentioned in the beginning, that this is a field where we really need to do more. If we look at Southwest Africa and Southeast Asia, the air pollutants, they can affect the precipitation through that they change the monsoon circulation and therefore the onset and the strength of the monsoon. So when we reduce air pollutants, we do tend to get more precipitation in the whole region of Southeast Asia. And in Africa, we can see here that we might get a drying here over the central areas. So to summarize, short-lived climate forces or air pollutants, they can both warm and cool the climate. And currently, the warming by methane and ozone almost balances the cooling by aerosols. And if we reduce sulfur emissions in the future, which is basically already happening, we will warm the climate globally by about 0.5 degrees Celsius in 2050. And I didn't show this, but if we look at the near-term future, this warming will actually be stronger than what we have due to increases in CO2. But these reductions will also improve air quality and global health. So we need to do this. And if we do it, we must then simultaneously reduce methane, soot, and eventually, most importantly, CO2. Thank you.
Yeah, so thank you for the nice talk, and as we already mentioned, we will take some questions now. So do you have any questions about this presentation? Yes, okay, yes.
Annica, I think you didn't mention it, but it seems that sulfur from 1990 up till now has actually increased the climate warming quite substantially. Could you say something about that?
Yes, I know that you are well. Yeah, if we look here at the past, which is also shown in this figure, I didn't go into details of this one because it's a lot of information here, but we can see if we go from 1990 to 2020 or 2015, so these two black lines is what has already happened, and there are two estimates of what has happened in the past. but they both show a strong reduction. So that has warmed climate probably by 0.5 degree, I think, almost already, the reductions that we have had. On the other hand, we also had a cooling down in the past from them. So yeah, it has cooled first, and now it looks like we're getting to true warming from the greenhouse gases, you can see.
Okay.
Thank you. Very nice presentation. I'm wondering how relevant is the ozone hole in this whole aspect? Is there still,
Yes. So actually, I didn't say that, but what we're talking about here in terms of ozone, it's basically the tropospheric ozone. So sorry, I missed to say that it's like the ground level ozone. So it's a different thing compared to the ozone hole. So the ozone hole is at about 20 kilometers altitude, and this is really what happens close to the surface. So they are unrelated to each other, you could say. Mm. But thanks for asking. It was good.
Thank you, Annica. You mentioned soot or black carbon, as you know the emissions as well as for other particles. But do we really know the amounts of soot emissions since they are from small scale wood burning?
No, I think you know the answer there. I think, yeah, it's very uncertain. And also here, I mean, I think this is basically what these. When we look at the carbon dioxide in the past, we have a pretty good idea what it's been doing. But when we look at sulfur and black carbon, so we have two different pasts here based on different inventories. And I think they are constantly being updated, actually. So, no, we don't know.
Okay, one more.
So I'm interested from a policy perspective. Like politicians like to take what they want for their own interest. So if you have a lot of cooling pollutants that they say, oh, this might be interesting for climate, and we don't have to reduce those pollutants. I'm interested in what you would say to them, and
what is
your perspective from that?
Now I managed to remove the presentation. I think that's where people here working on health are coming into the picture. So the two, I think this would be like one thing to show them that it will save lives if we reduce sulfur. So yeah, you can then of course get into the discussion what causes more deaths, a warmer future or more air pollutants. But I think also, I can't go into the details here, but carbon dioxide and sulfur, they have quite different climate effects. So some of it, I think you can probably get from this picture. Even though the global average temperature on the long term looks the same, we have precipitation differences. So they do have slightly different climate effects, and I think they will not cancel out each other completely. And also for particles, we reach a saturation. We can't emit tons of particles into the air. I don't think that's realistic. So we reach kind of a level where we have a concentration that can't be increased more. While carbon dioxide, it stays in the atmosphere and we can just increase and increase and increase.
So two comments. One, I think you can actually increase the amount of particles in the air quite substantially if you go to places like India, for example. It seems like you can put a lot of particles into the air there. But the other comment I wonder about the number of deaths there. Are those also the number of deaths from particles or just sulfate that you can save? Because
this is from all short-lived climate forces. This is not my expert area. Maybe Håsi knows more here, but I think it's all the short-lived climate forces that are included.
Because of course, you know, particles kill. I mean, if you're reducing, can you reduce just sulfur, or do you reduce sulfur and particles in the same? I think that's more likely that you do both. And in that case, you're actually saving even more lives, if that's how these numbers are calculated.
Yeah, okay, Håsi.
This is calculated on PM2.5. And PM2.5 is 30%, roughly, or if you look at generally, 30% of PM2.5. So if you reduce sulfate totally, then you will get a 30% reduction of PM2.5 and roughly a 30% reduction of those numbers. So Inge, increase.
30% here comes from sulfur.
So in that way you can't differentiate between PM2.5 and sulfate because it's an entity of it. And PM2.5 is then half of it is organic, or 30% is about organic, and then you have nitrates and you have black carbon. Black carbon is about 5% or something like generally. So then you can see how the reductions on those could affect the health effects.
But just coming to like the kind of saturation of particles, I think, yeah, we can increase, like we see here, like you say, over India, but because they fall down relatively quickly from the atmosphere, they're still going to be like, you need to put up a lot for it to not disappear within just a few days. So we need a constant then supply of particles to the atmosphere, which costs energy.
Okay, so I think unfortunately we'll have to cut the discussion short here. We have time for one last question. I think there was one.
There's one there.
Over there. Okay. Oh, yeah. Okay, maybe it has disappeared. Then we can.
No, but there's one there.
Yes, then we can take this question instead.
I'm just wondering about the effects on a very local level. Is there any scientific way to see, for example, how one road would affect the area around the road, or are we talking about a bit bigger local effect? If you understand my question,
yes.
Could you contribute risks to health from a road to people who live nearby it?
Yes, I think there Bertil is the real expert. But you can do, so this is a different, so here it's climate models, and we're really coarse, like 100 kilometer grid boxes that we use. But you can also go down with different models to a local scale and with measurements and try to look at the relations. So yeah, maybe that will come later during the day as well, or?
Yeah, maybe in the next talk.
Yeah.
So.
Well done.
Okay, thank you again. And then I would like to introduce our next speaker, Erik Melén, who is a professor at Karolinska Institute and works on more the health side of things, specifically on respiratory and allergenic diseases in children, and the factors influencing those diseases. So the floor is yours.
Thank you so much. And thanks also for the transition question to the health effect. I think that's good timing. So really a pleasure to be here. I'm a pediatric allergist by training, so I see patients once in a while with severe asthma or lung function problems or allergies. I work at the Karolinska Hospital, Södersjukhuset, and I'm also professor of pediatrics at Karolinska. So we'll talk about air quality, climate change, health effects across the life course. And a disclaimer, being a pediatrician, I think that a lot of things start in life and they are important not just for children but also for the remaining life. So there's a conflict, not conflict interest, but I have a bias towards thinking of the children, and that early life factors are important also for the adults. Anyhow, we've been talking a lot about the air pollution and the silent killer, and that's really key messages here as well. If you look at some of the communication slides here from WHO, stroke, heart disease, lung cancer, chronic obstructive pulmonary disease, COPD, etc. That's a lot of adult diseases, right? So the communication is also on the adult conditions. Whereas we also know that more than 90% of children breathe toxic air. So here's my perspective is really on the children, and I'll give you good examples for why. And also there is hope, again, with the new global air quality guidelines. There are millions of lives to be saved, also morbidity, but also mortality. So why put the focus on children then? We believe, we know they're more vulnerable to hazards. They spend more time outside. At least that used to be the case also in Sweden. We know a lot of kids are also sitting a lot indoors nowadays. But typically, children spend more time outside. They're active. Higher rates of breathing and ventilation rates relative to their body size. They get very narrow airways. We know that RSV season is coming up, and we know that that virus is really causing a lot of morbidity and also mortality in young infants, because the airways are very small, and any insult, being air pollution, being a virus, anything that would trigger inflammation, mucus production, etc., may have severe effects. So obviously also there is ineffective airway particle filtering in the airways, underdeveloped detoxification systems, underdeveloped immune systems. And more importantly, here's a picture of photo taken from Stockholm. Children don't choose their lifestyle and the environment. And then, of course, there's a societal perspective. We need to take that into account, certainly. I think this has been mentioned already, but we know quite well there are numerous health effects in children if they're exposed to air pollutants, already starting during pregnancy or in utero, with the growth impairment, preterm birth, etc. There's also evidence of preconception exposure having effects on the unborn child, so to speak, through epigenetics, etc. So that's a very, very exciting field, but also scary to some extent that mothers and fathers to be teenagers, their exposure will affect their future kids. Infections, certainly, lower respiratory tract infections, asthma, lung growth, we'll talk about that in a while, and that will lead to COPD risk. Cognition and impaired cognitive development, and also mortality, obviously. I mentioned the life course perspective, and I'll just put that one example that we put together last year here. It's very clear, and also Barker was clear, also shown that many years ago now, and that not just the lungs in focus here in the figure, a growing child with influence from the exposure from many sources, air pollutions. We talked about climate change, obviously. Here is an allergy asthma perspective, but also microbial components. Allergens and the exposure at large, of course, will have an influence on the immune system, on the developing lung, developing organs, and that has relevance for later, absolutely. I'll take the example of lung function here, because we know pretty well also the link and the life course perspective. Here's on the x-axis, here's age, and here's a newborn child, and here's an adult person. We have lung function here on the y-axis, with roughly maximum attained level of lung function at the age of 25. So that's when lungs and, like, I believe, the brain is fully developed. And then from there, there's a normal decline in any given person. But you see also there are a number of other trajectories here. And there's the supernormal, all those with a very high lung function. But more importantly, here are those who start off very low, and then they typically continue to have a low lung function. This is early life exposure, passive smoking, air pollution, but also preterm birth, early life infections, etc. And typically, if you reach adulthood with the level here, you don't catch up, you don't gain. It's almost impossible to get to another level. So this is very, very important. Why? Because here you are absolutely at risk of chronic airway disease, COPD, and also this very unfavorable curve with early death. And we know very clearly also that, again, the exposures early in life will influence these trajectories. And once you hit that, once you achieve that level, it's very, very difficult to change. What about air pollution now? This is the air quality index. I put that here not because you know the field very well, but I think for me as a clinician, we need tools. I need tools to show my patients and even the children. Look here. This is yesterday evening's data and real life data on the exposure or the air pollution levels. We need tools to show our patients and also show to people. So I think that's important. Also very clearly that obviously this is not a fair game. So there's high level exposure over Southeast Asia, part of Europe, and we're up here. So next, where are we? This is, as of yesterday, we should be pretty fine. Here in Stockholm, it's mostly reasonably low levels. Now that's good. That's good news, right? However, I want to show also some data from Stockholm and from our data that this appears to be good, but we do see health effects also from the levels to which we are exposed to. All right, the first example here is again from beautiful Stockholm. A paper published last year. We looked at air pollution exposure early in life, around at birth, and also within the first 6 months of age. And then we measured lung function at the age of 6 months in infants. And again, it's very clear, and speaking to the question before, is it very local or is it very regional, average exposure? Here is clear, it's very local. We look at the individual level exposure, street by street. So there's differences in depending on the amount of traffic and other aspects of the city life, but very clearly there's very clear local effects. So look here, if you're the higher exposure, the lower your lung function. Lower your lung function here, and we measure forced expiratory volume in 1 second or in a half second in small kids. So clearly signals already at the age of 6 months in Stockholm. In the PAMSA cohort, we also study 4,000 individuals followed from birth, and now they're around 25, 26 years of age. We see that chronic bronchitis, which we believe was a smoker's disease previously, 1 in 20 of our young adults have chronic bronchitis. 1 in 52% have airflow limitation according to COPD criteria. Now that's average, this is population based. We didn't think COPD existed in young kids or in young individuals. Here, 2% have lung function comparable to, in agreement with COPD. And this is not just lung function, or this is not just a register-based study. This is cough, leg, recurrent airway infections, respiratory symptoms. And very clearly, look at the data here. Air pollution exposure, first year of life, strongly associated with the conditions here at the age of 25. So very clear effects early life. And this is, again, Stockholm. Not just lung function or asthma. During the pandemic, we were also fortunate to be able to study this group and could link current air pollution, not just with asthma lung function, but also with a COVID infection and the risk of having long COVID. So that is also an important other aspect to think about when it comes to societal situation. And we receive some media attention for those because, again, this is important. Let's mention a little bit, not just air pollution, climate change also carry other, of course, consequences. And I want to highlight here, I see allergy patients, and we are more and more concerned of the situation for allergy patients. And why? Because we see altered pollen season, spread of allergens to new areas, new species. We see an altered biodiversity, and this has implications for the diagnostics, for the patient, for the symptoms, etc. So I'll give you, for examples here from the allergy field, and that's when we see the average temperature increasing. Then we also see very clearly the total allergen load. So the higher the temperature, the more pollen, the more allergens that we can measure. And this is important. So there will be patients will be exposed to a lot higher pollens with higher temperatures on average, right? Also, there's a trend. There's a time trend here from 1990 to 2018, and you can see a very upward trend towards more and more pollen exposure on average, right, when measured. This is North America, but same thing is seen in Europe. So this is happening, and it does influence, again, patients, diagnostics, etc. It's also quite interesting if we get into details here. This is experimental work. Elevated CO2 levels produce pollen, which elicits stronger allergic lung inflammation. So it's not just about what you're exposed to in general, more or less allergen levels, but it also that interaction between the exposures, particles, gases with the allergens that apparently may have a worse effect on your airways and the immune system. So those aspects are also quite important. It has I saw Lyme disease, and we talked about Borrelia before. This is a I would say, fascinating story immunologically and also for the patient. It's about a tick bite that will here, and we see tick bite that can induce an IgE reaction to something called alpha-gal. It's a carbohydrate that the IgE triggered by this tick bite is an IgE towards a carbohydrate, and that's linked to the tick bite, and that induces an immune reaction and IgE production. Now that carbohydrate does exist in red meat. So when a person got tick bite a year later, a new tick bite, an IgE towards this carbohydrate can develop, and that carbohydrate is also present in red meat. So here a situation where a patient can have a red meat allergy reaction, and this is hives, nausea, vomiting, diarrhea, cough, etc., and also systemic reaction, urticaria. Now this is becoming more and more common, also because we're seeing more and more ticks, and we see tick bites. Again, it's a fascinating story. So yes, allergy to red meat exists, but it's a link through the tick bites. So these are also consequences that we actually have to take care of. I want to say something about mitigation, because I think also this is where an important discussion for me as a clinician also when we want to communicate these aspects. I've been part of writing the paper here for asthma, and also just realizing that what we do in clinic and the treatment we're giving also contribute to climate change. Every puff of salbutamol is estimated to be approximately equivalent to 1 mile travel in a petrol car in terms of global warming. These are massive numbers, and we know that, of course, you have to take your inhaler if you need, definitely, and we need to take care of our asthma patient, but this is also information that we need to actually take to our heart and also discuss with our patient. We wrote this piece also to guide a little bit clinical guidance. How do we communicate these things, and what can we do about it? So I was part of the European Respiratory Society effort to do this. And we came up also with a couple of actually items that we can also low-hanging fruit do right now. We have to acknowledge and discuss with the patients and children climate change and what does that do to the patient? Not just increased risk of exacerbations or emergency visit, but also the other part here. Educate, of course, discuss about the vulnerable populations, and think about the climate-friendly activities. So this is time for us to bring that to the clinic and bring that to our patients. I think also highlighting here that of course the drugs that we use, make sure that we choose the right drugs, and then we can discuss also how we get that. But it is clear cut with powder having a lot less impact on the greenhouse gases than the sprayed inhalers for when it comes to asthma, for instance. So this is also an action where we are now putting our efforts together in the asthma field. I want to say something also about other huge efforts. Now we're part of a European initiative to discuss improving urban population health. How can we maximum health in urban cities and urban context? I mean, 80% of the world's population will live in an urban situation. This EU project now is focusing on describing and exploring the exposure that we are facing in the urban context, but also how can we improve that in order to also improve health. These are very, very nice initiatives and important, I think, because we know that people move within the city. This will have an effect also on the exposure that you encounter. And it was brought up here before that this is, again, social. There's a social component, there's a social context. This is not average moving. People with a high social class or with the income will move to certain areas. Other will not have the opportunity to move to another. So there's a lot of important messages here as well. And we unfortunately are seeing a more diverse society, I think. So what was brought up here before, I think highly relevant, because the exposures that are unfavorable will go hand in hand with the most deprived social areas. And this is where also we have to act and think. Not just everything is getting worse, and that's also important. These two papers come from the California group a couple of years now, 10 years ago or 15, 20 years ago, the effect of air pollution on lung development. And in California, they could see that actually the air quality did improve from like mid-90s up to 2010 something. And they could see also effects of lower asthma and better lung function. Now that was California, and we all seen the really very tough situation that they had with the air quality in California. But we were also very happy to see the same situation in Sweden. And this paper we published earlier this year, where we looked at the air pollution levels and lung function growth in children. So here we have seen, and you are maybe aware, actually some of the levels, this is PM2.5 in Stockholm, have decreased over the last 20 years. Now that's great news. So we can improve the situation. And we've seen that here also, that lung function does improve if your air quality where you live at that particular street, there's a better lung function growth. And for every unit improvement in the exposure here, the particles and black carbon, etc., there is a number of milliliters improved lung function in the growing kids. This is very, very good news, and I think encouraging. Where you just submitted this paper also, where we look at the air pollution and the asthma incidence. We look at the air pollution up to 8 years, and then see what is the incidence of asthma up to adulthood. And we see here, for most cases, most individuals will actually have a reduction in the particles. But for the patients or the participants belonging to this group, there is actually a substantial reduce in their exposure. This we've seen in Stockholm over the 20 years. This is really, really good news. And what happens then with the asthma risk in these groups? Look at the asthma risk here is almost half if you had lived on a street where your air pollution levels have come down. So there is positive signals coming from the data. Actually, if we improve air quality, we will see reduction in asthma incidence, and we see improved lung function. And we can have scenarios here. This is a natural cause in this study. If we didn't have the improvement, we would have had 11 or 12% more asthma cases as of today. And then we can, of course, discuss whether there's even further reduction, and then make assumptions on we can reduce the incidence of a chronic airway disease like asthma. That's why I think it was very positive signals from the European Parliament. I'm sure many of you were involved and are very well aware of the fact that the European Parliament did adapt to the suggested more strict emission lines and a better air quality. This was a vote in the Parliament as of 13th of September. And really the aim to go for a much more strict air quality index now is with the EU Commission, I believe. Well, hopefully we will have these positive news translated into a directive also that will help us to get a really good air quality. But I just want to highlight that, and I think that was really, really also positive news from the EU side. Very well. I'll sum up here by saying better air quality, better health, bigger lungs, and we've shown that. That goes also for Stockholm. And of course, all air pollution exposures matter, and the lower, the better. Urban exposures do change, and we've seen examples here from the Stockholm that the situation can be improved, so let's continue on that route. And the prevention of chronic respiratory, I would say also cardiovascular and cognitive disease, starts very early. So thank you for your attention. Here's an acknowledgement for the people in my group and with the collaborators. So thank you.
Okay, thanks a lot for your presentation, and I'm sure there will be a lot of questions. Yes, okay, let's start up there.
Peter Stenviker from Karolinska Institute, very interesting data. There was a recent paper in Nature Communications showing that if you go over to more plant-based diet, that will cause significant reductions in the harmful effects of air pollution. And have you in your data, or are you aware of any studies that have looked if dietary shifts toward more plant-based diets could actually reduce mortality due to air pollution?
Thanks, Peter. I think this is an extremely interesting question. There are experimental studies I know also where children or participants in a study with a very high air pollution exposure or in experimental settings are also giving some supplements. That could be vitamins or antioxidants, and there's in some studies there seem to be an effect, more protective effect. We do have some dietary data also in Bamse. We don't have the plant-based data, that level of detail. I think an extremely important field, very promising work. I would call for also more research in this area. The nutritional epi is also challenging because getting the details of how people are eating, what are they eating, is also cumbersome. But I think it's very, very promising data, and I'd like to see more studies in this area, yes.
Okay, Jose?
Yes, as you see, the effect of different air pollutant components are very different in climate. And don't you think that there should be a lot of different effects on the health system of different components of air pollution? You talk generally about air pollution. For example, black carbon has been discussed very much and put forward, but WHO don't seem to accept there is a difference there. Could you explain why?
No, I can't explain why. Some of the models here, and then Petter, for instance, the audience is more knowledgeable in this. We have challenges to really disentangle the effects from different particles or different gases because they're so highly correlated. So in the epi studies I've showed here, we have a hard time to disentangle. I think at the end you may need studies with a better contrast between different sources and different components, and you need experimental data to look at what is the effect of each of the components. For the legislation, for the down the road, of course, it's quite important whether it's the gases or the small particles, ultrafine particles, or it's generally. But I think Bertil thought Petter are better suited to answer the question on the different components, different particles, and the health effects related to that. Do you want to comment, Petter?
Well, I think for black carbon, I mean, basically why it didn't, I mean, it was mentioned in the WHO in the last guidelines, but basically as something that we should encourage more research and exposure assessment for, because I think that's one of the drawbacks. There's a lot of work on PM2.5, and that's where we have an abundance of evidence, which is why there's much more confidence in those kinds of studies. Black carbon, it's not the same story, really.
And I think we're generating good maps and good exposure models for ultrafine particles as we speak. So we haven't just had the data, I think, but we'll get there.
Okay, there in the back.
Yeah, thank you. So we touched a little bit upon this also in previous presentations on like that we need to communicate the climate crisis a bit more efficient. And I think you make a really strong point that if I skip taking my car to work today, I actually decrease the risk of a kid dying from asthma or maybe having more strong symptoms. So that's something, I don't know if you have these numbers, like, that you actually say, so one drive to work, because traffic in Stockholm is a problem. And I mean, it could also be like a stronger incentive for cities to go carbon neutral or whatever. Like it's not some child in India, it's like our kids.
I hear you. Thank you. It's a really good point, and you may follow the literature also from London, where they in court also made the case clear that air pollution killed that girl suffering from severe asthma. I mean, she suffered from a fatal attack of asthma. She died from asthma, but that was because of air pollution exposure, and that's been communicated very nicely. Not very well done to communicate. I think we need the cases. We need to make the clear cut also situations where one single drive with car will yield this exposure, and that will translate into XYZ% risk or something. I think that's really where we need to go to get to the next level of appreciation and understanding.
Exactly, and I mean maybe you can come up with these numbers before we have actually kids dying.
Kids
dying, right?
Absolutely.
Because I think this is much stronger and efficient or effective than people gluing themselves on the E4.
Agreed.
For similar reasons, but
Yes, agreed.
I know you tried to say something.
Yeah, I just wanted to comment what Jose said and your results, Erik. If you see the global picture of the effects of PM2.5 in general, driven by secondary PM, the effect seems to be much smaller per unit than the effect you see here in Stockholm, for example, where it's local particles, it's exhaust particles, wear particles, and I agree with Jose that I think WHO has been too. They have not really accepted what it's shown by a lot of studies now when they have written about this in the new air quality guidelines. They even say that if you study areas with lower PM2.5 levels, you see stronger associations, and that's areas where you have a lot of fresh local PM2.5. So I think they could have gone further with this discussion about different effects of different types of PM2.5.
Great.
Me? Yes. Yeah. You had a countermeasure listed on a slide to focus attention more on vulnerable population groups, and I was wondering around vulnerability. Your presentation was focused on children, which is very understandable. But I wondered, first of all, Is there an increased vulnerability higher up in the ages? For example, you talked a bit about younger adults. How far up in the ages can we see particular vulnerability for the effects that you discussed? And also for the health effects that you discussed, are there other population groups that are particularly vulnerable, not focusing on young adults?
Well, now being a pediatrician, I can only answer up to the age of 18, obviously. But no, I think I think the general appreciation is really that there are no safe limits, there are no safe age periods. There are health effects in all ages, from preconception to the very elderly. I think that's also, acknowledged. We should highlight that. The other thing that I mentioned here also, and John mentioned that very nicely. Now maybe he left the room, but the socially deprived areas, families, children, individuals. I think that's where we see the strong, big challenges, and we will have those are the most vulnerable, including multimorbidity. Is encapsulated in there. But I think that's where I think we also would have to, if we want to maximize the preventive effort here, that's where we see the challenge, I think.
Yeah, I have a question. Thank you for a nice presentation. And I was thinking about, you showed us from the Stockholm data that sort of we have a decrease in these emissions. And I think one way to communicate the benefits of this is to say, do you have any good idea, any good measures of why it is decreasing? Is it because of electric vehicles, or is it because, what is the reason for this decrease in emissions?
Yeah, very good. Thanks, Olof. I think it's a very important question going forward also, where we should put our efforts and what can we achieve. I think there is first of all, I'm not the modeling expert, so I have to, maybe others can answer better than I can. I think it's a combination of several factors. So the traffic restrictions, one thing. We have a much better car fleet, much more modern car fleet today than we had 20 years ago. I think that certainly has influenced. And also we're not using studded tires on certain streets, for instance. The electric car fleet has, of course, contributed, but not the most of it. The most of it was pre-electric cars, I think. But I think it's a combination of several measures that and we see the end result here.
Okay, so at this time we'll have to end the session. So maybe if you have remaining questions, you can try and catch the speakers during the lunch break.
Yeah.
And,
maybe we can just go ahead and thank our speakers.